speakers do have already have enough knowledge for diabetes because Dr. Chima is always providing you some information on the TV and radio. But today, you will be able to listen to the expert speakers discussing many aspects of diabetes. They will show you in a different method. They will make you understand in a different. We are very thankful that we are in Canada and we have all these opportunities available in different language. So there will be 8 different speakers. They will provide you information in 2 different sessions. There are psychologists when because the hormones changes with diabetes, how the problems with your eyesight, with other problems with diabetes. They will share all kind of information. Now we are not going to waste your time too much. This is the time we have to bring our first speaker, Harwinder Gill. Harwinder Gill is a registered nurse. She finished her nursing degree from Kwantlen Polytechnic in 2006, and from last 12 years she is working as a diabetes educator nurse. Before that, she worked in a palliative care. She has experience with that, and she tried really hard so that she can educate in their own language our Punjabi about the diabetes and chronic diseases. She she also revised the Punjabi version of a booklet. So yes, Harvinder, come and introduce yourself to the listeners. She will talk about the introduction to the diabetes and its complications.
Today, we know we'll talk about diabetes, and we're going to cover so many topics. First of all, what is diabetes, and how do we know that if we have diabetes or not? And what are the symptoms? We'll talk about that, and then we'll talk about what the risk factors. Is it ethnicity or lifestyle, age, if that makes any difference, if we have diabetes or not, or if we will get diabetes or not. There are 4 types of diabetes, and we'll talk about those. And there are other diabetes as well, caused by medications and any other damage caused to the body. We'll talk about those too. We'll check our blood sugar at home before eating, after eating, how much it should be, what it should be, and A1C, what it should be, and to prevent the complications. And the doctor should know if we have type 1 or type 2, and there are different tests they can do if we have type 1 or type 2 diabetes. But in our culture, mostly it's type 2 diabetes. And how to look after your feet, and if you have diabetes, if you don't take care of it, and what are other dangers that we can face. We'll talk about those. And exercise, why is it important, and how much. We'll talk about that as well. What is diabetes? Before understanding this, we should understand what happens to our body. If our body is working regularly as it should, or when we have diabetes, how different that is. You can see we have organs, we have pancreas, and diabetes, when the pancreas create insulin, and it's like a key. Without that key, the sugar cannot really get dissolved in the body. So that is the key, and to use that key, and it goes into your kidneys, it goes through your body to use as power for your body, and it's stored. When you have the diabetes, and what diabetes it is, we'll talk about that later. But the main function is pancreas insulin is not making insulin, or it is not working well, or not getting dissolved. So, what are the symptoms of diabetes? Type 2 diabetes, then we know what the diabetes is. But the type 2 diabetes, sometime up to 60 years old, we don't know because sometimes there are no symptoms. So, according to the Diabetes Canada guideline, in few years, and we don't know until we get the complications. So, do the blood testing. It's really important to get it done. Talk to your doctor about that. You can get it done. We'll talk about that later. But if we know if we have the diabetes or not, if we are urinating frequently, not hungry, or feeling hungry even after eating regularly, feeling thirsty, and blurry vision, and cuts are slow to heal, and weight loss as well. We eat regularly and everything, but still, our weight is going down, or numbness in our hands, feet. These are the symptoms of diabetes. But type 1 diabetes type 2 diabetes, as I said, that happens. There are so many patients I have, and they just went for an insurance test, and then they realize they have diabetes. So it's really important to get your blood work done, to testing done to see if you have diabetes or not, if you have symptoms or not. And if we don't really look after diabetes, what can happen to us? There are so many problems. We can have strokes, and it can affect your brain. It can affect your eyes. Then we might have to get some injections done in our eyes. So if we don't care about the health, blood circulation problems, and a lot of time our kidneys get damaged as well. And sometimes we have to go to dialysis for that. And the feet problem is quite higher in these patients, get infected, and sometimes you have to get amputated. So you really have to look after your feet. You can prevent all those complications. And even if it is a minor injury, it can cause big problems if we really don't take care of it. And last thing is neuropathy, and it's hard to explain in Punjabi. It's like putting your hand on a stove, and if it is hot, you remove your hand right away. So your nerves get damaged, and that controls your body as it should. So it can cause nerve problems as well. But if you're drinking and we have diabetes, it can damage it further. So we'll talk about the nerves as well, because if we are unable to digest our food, and we can have those problems as well due to diabetes. It's really important to control the diabetes as much as possible so that we don't have those problems.
What are the risk factors that we get diabetes? If we are in a Punjabi family, it's like stigma that we are going to have diabetes. For example, South Asian, South African, the number is high in this population. If we weigh more as compared to our height, and if we have belly, if we have our parents, our grandparents, they have diabetes, we get diabetes probably. And the age factor, and then if we are above 40, there are chances. The type 1 diabetes is usually in the children. But we also notice, if you are up to 20, then it could happen. Later type, like that's present in the older population. Usually, for type 2 diabetes, if we are above 40, then there are chances you will get type 2 diabetes. Hypertension, high blood pressure, high cholesterol, not healthy diet, or if you have a sedentary lifestyle, you are not active enough, you are not exercising, and you are in a stress. Stress is one of the reasons that will cause diabetes. So we talked about types of diabetes, but there are two types of diabetes, type 1 and type 2. You can see in the picture. The healthy pancreas creates insulin, and then the body take insulin from that. It get absorbed in our body and different organs. In type 1, the pancreas completely stops and it doesn't make any insulin. So there is no insulin in the body, and then there is more blood sugar in the blood, and because the pancreas is not working, then you have to have shots. There is no other treatment except the shots. Exercise helps, but mainly the treatment is the shots. So type 2 diabetes, for type 2 diabetes, in that case, the pancreas is creating insulin, but slowly, gradually it decreases. It's like the key is, but then it cannot work as a key. So if there is a belly, if we are not exercising, then there will be high blood sugar in the blood. The secondly, gestational diabetes. The gestational diabetes is during pregnancy. That's temporary. Usually 60% of women they get type 2 diabetes later on in their life. So if it's very important then to take control of it. Pre-diabetes is that we have a chance now, that there are chances we're going to get it, but we don't have it yet, but there are chances. So we can correct our diet, we can exercise, we can correct it. There is diabetes that's not chronic, it's a temporary condition. Sometimes there are medications, some therapies. Sometimes our blood sugar is more. Sometimes. Mainly there is type 1 and type 2 gestational. These are the main kind of diabetes. So when we have diabetes, you can see on the screen people who already have diabetes. This is for them. People who don't have diabetes, their targets are different. It's not for them today. This is mostly for people who have diabetes. When we check our diabetes, our blood sugar at home, before eating, before the meals, we do check. Yeah. Then our blood sugar is all right. We know that it's gonna be up after the meal. Then we see how much is up. Then we get stressed. So we should check before the meals and after the meals. So the doctor will tell us how many times you have to check your blood sugar. So before meals, your blood sugar should be 4 to 7. But if you have to measure like the Indian way, then you have to multiply these numbers by 18. So 2 hours after a meal, you should check your blood sugar again, and that should be 5 to 10. But we have to see how much it was before and how much after the meal. So how many points is up? If before meal is 7 and then after meal is 10, then it's okay. It should be only around 2 to 3 points up. If it's before meal 4 and then after meal 10, then it's a big jump. Then we have to really look around what we eat. So do we need medication? Do we need exercise? Or do we need to change our diet? Second test is every 3 months. You can, if no fasting required, you can go do anytime. That's called A1C. What do they do during A1C? How much blood sugar is attached to our red cells? So every 3 months they check your red blood cells, because how much sugar is attached to the red blood cells. But home testing has different numbers. A1C is different numbers. So we have to keep it 7%, under 7%. If it's more than 7%, there will be complication with the diabetes, and the chances are more for complications. If we get the diagnosis. If we want to get the diagnosis type 1, is this type 1 or type 2, is usually with the blood test check. But there are other tests that you have to do, GARA 65, to confirm if we have type 1 or type 2. Most of the time we know right away which is a type 1 or type 2, but there are times when that it could be type 2 or type 1. Then we have to go for further testing, that is it type 1 or type 2. So if you don't know your diagnosis, you talk to your doctor and you go for blood test and you confirm with more further testing. So every 3 months, please check your A1C.
So,
Now we'll take some more time to talk about foot care. As we say, that if you have eyes, you can see. But if you don't have feet, you cannot walk if you have problems. So these are regular things you can do. But if you don't take care of your feet, you cannot work, you cannot walk. So it's really important to take care of your feet. First of all, we should wash our feet daily very well and dry it, especially between toes. So between your toes, make sure you wash and clean and dry. And feel your feet for bumps or temperature changes. And if you cannot see underneath, you can use mirrors, and it's really important to check underneath as well. And if you want to use any lotions or anything, we can use it, but don't use lotion between the toes. And if you have many dry cracks and chapped heels, you can use that. Then you can use special creams. Then the dry, you can peel off the dry cracked skin. But if there's any itched bumps or anything or any injuries, we should make sure that we don't peel it off, because that can cause infections. So when you're checking your feet, if there's a redness or swelling, and if there's any leakage, and then it's been going on for a week or 2 weeks and it's not getting well, then get it checked from the doctor. And when you have diabetes, you should get your feet checked at least once a year. And when the doctors are checking feet, they're making sure, and they do all the testing, and they will check underneath and on the top of the feet as well. If you can feel it or not, they're going to check the color as well. And they're also going to check if they have any swelling or any different shapes. And when you're wearing your shoes, make sure you clean your shoes. And one patient told me, and they said, I usually put my keys in my shoes, and somebody needed a key, and they took the key, and they didn't know. And they didn't know the key was in the shoe. And that caused some injury to the feet. And then, it was leaking. So we need to make sure, sometimes we don't know what's underneath our feet. So when we're buying our shoes, make sure, when you're trying new shoes, try it in the afternoon. So if there's any swelling or anything that can happen, and especially the toe, the biggest toe on the side, and it should have 1 centimeter gap between your big toe and the front of the toe of the shoe. And if you have socks, and if there's any marking or anything when you take your socks off, then it's too tight. So we should wear socks that keeps our feet comfortable, and then your feet are not ventilating well. If you have socks and then tight shoes, you're restricting it. So make sure you you use good socks, good shoes. We take it off, and we should check our socks to make sure there's no discharge on it. So you should always look after feet as much as possible. And it's also very important to control our sugar levels. You can take care of feet, but if you don't control your sugar, then we cannot reduce the risk that you can face further in life. So it's very important to take care of your feet.
So also remember, if you have a little or small injury, it could get into a big injury. It could be a big wound. So it's very important to keep it. So write a note. If you have a problem with your feet, then talk to your doctor. So in the end, we will talk about exercise, physical activity. So usually when it's summer, we are very active, we walk, we do exercise. But when it's winter, we always stay inside, right? So it's very important to have exercise for cardio, like our heartbeat, at least half an hour every day. If not every day, every other day. So our body gets back to normal if we should do it every day, at least half an hour after the meals. Don't talk empty stomach because our blood sugar can go up. So we after the meals, so that the blood sugar that came from our food should be used. So there is another exercise that's called a resistant exercise, like belts, like weights, just to lift up your body. So at least try to do it 3 times per week. Lastly, stretching. So whenever we exercise, we should also do some stretching. We need it as well. So we should do it 3 times per week at least. If we are above 40 years of age and we never exercised in the life, not walking or we don't walk, so talk to your doctor at least, so that we make sure we are good to run or not, or good to walk or not. So if you have heart disease or some other thing, please talk to your doctor, consult your doctor, so that he can advise you what kind of exercise is good for you. These are our sources. Then Harleen will tell you later on what kind of resources we have, and during lunch also. So whatever materials I used for the information, you can get them. Thank you. Welcome.
Thank you so much, Harwinder.